The union has said it won't accept major cuts at the Norfolk and Suffolk Mental Health Trust, which it says are putting the safety of patients and staff at risk. Unison has raised the issue as a formal grievance, and if nothing's agreed, there could be a chance of industrial action.
In a darkened studio maintaining her anonymity, this Norfolk woman told me of the 10 years of vital support she received for mental health problems that began when she was a young student.
I always had a care coordinator, well, most of the time, and that was a woman I could phone when things were difficult, but also someone who would see me when I was well and who knew me as a whole person. They could halt that spiral into chaos that absolutely terrified me and could lead me to do something really dangerous to myself.
And what about now? Do you think that would be there, that support will be there now under the trust?
Not really, no. I believe there are 300 to 400 people without a care coordinator. That is the person who makes sure you are safe. They literally care for you. Without them, I think it's a very, very dangerous situation, and I don't think I'd have survived.
The now discharged patient's concern fuelled by £40 million budget cuts at the Trust over 4 years, a shake-up involving 400 job losses and a 20% reduction in the number of beds. Sheila Preston is a newly appointed governor of the Trust and a long-term carer for her son Leo, pictured here as a schoolboy, diagnosed with schizophrenia at the age of 20.
It's an impending crisis, and I think the Trust has got to take a breath and look at what is happening, what people are saying. There's got to be a regular, meaningful interface between service users and the Trust.
Management tonight denied that the Trust is in crisis.
No, I don't think we are in crisis. We have said all along that there are issues within some of the services that we provide. We recognise that. I've been to both health overview and scrutiny committees in Norfolk and Suffolk recently, and we've acknowledged that there are issues around the access and assessment service. We've committed to a review of the bed situation in central Norfolk, and we are looking and working with the community teams on their caseloads. Sometimes those changes take time.
The Trust says it will continue to implement its strategy, but it remained under constant review and consultations will continue with unions, staff and patients and their families. It rejects any suggestion that the services it provides are unsafe. Kim Riley, BBC Look East, Norwich.